I really didn't expect myself to survive.
It really is a silent killer.
It is a conscious choice that you don't want to become sick.
You can truly take charge of it, but don't wait for the bomb to drop, which is what happened to me.
Heart disease is the #1 killer of women, but the good news is that heart disease is largely preventable just by living a healthy lifestyle. Our heart health is in our hands. To warn us about our #1 killer and inspire us to take action against it, the National Heart, Lung and Blood Institute, NHLBI, created the Heart Truth, a national awareness campaign for women about heart disease.
We know that if women take care of their hearts and are aware of their risk, they can reduce their chances of developing coronary artery disease. Some of the risk factors that you can control are smoking, high blood pressure, high cholesterol, and high triglyceride levels, diabetes and prediabetes, being overweight or obese, being physically inactive, or having metabolic syndrome. The risk factors you can't control include having a family history of early heart disease, being over the age of 55, or having had a history of preeclampsia. It's also important that you know your numbers. We want women to discuss with their physician exactly what their cholesterol numbers are, their blood pressure readings, your body weight and your body mass index, as well as your glucose numbers and whether or not you're at risk or may have diabetes. So it's identifying your risk factors, having a personal conversation with your doctor about your personal risk for heart disease, and targeting where you want those numbers to move in order to reduce your risk for heart disease. Commonly, when people refer to heart disease, they're speaking of coronary artery disease or coronary heart disease, which is a process in which plaque builds up in the arteries of the heart, and particularly the arteries that supply the muscle of the heart. In a heart attack, an artery that supplies the blood to the heart has a buildup of plaque in the artery that ultimately can rupture and cause a blood clot to form in an area of the artery that could block the flow of the blood down to the heart muscle, and that would cause the heart muscle to die. If a woman's experiencing signs...
Heart health is important at all ages. Having just one risk factor can double your chance of developing heart disease. 2 risk factors can quadruple your risk, while having 3 or more risk factors increases your risk for heart disease more than 10-fold. Prevention is key. Here are some steps you can take to improve your heart health. Don't smoke, and if you do, quit. Aim for a healthy weight. Overweight and obesity cause many preventable deaths. Get moving. Try for 30 minutes of moderate intensity activity a day. Eat for heart health. Choose a diet low in saturated fat, trans fat, and cholesterol. Eat plenty of fruits, vegetables, whole grains, and fat-free or low-fat milk products. Know your numbers. Ask your doctor to check your blood pressure, cholesterol, and blood glucose. Work with your doctor to improve any numbers that are not normal. Know your family's medical history, because the Heart Truth starts with you.